Can I suggest we do this, because I think we need, do you believe you'll get a second bite of the apple here with Coburn, Burr, if not the entire package, certain elements of it when the bills come together? You think you'll get a second opportunity to make your pitch?
Well, we will on the Senate floor. But
right.
What will happen is we have common sense proposals. Let me make one other point.
Sure, go ahead.
If you really don't create a system that manages chronic disease, where you contain the costs of that, and you incentivize the management of that, either through whether it's a Medicare program or an insurance program through Medicaid or private insurance, where you're incentivized, we'll never get control of the cost.
Right.
So that has to be the #1 concern. In the bill that came through the Help Committee, we create 84 new government programs that's going to require over 100,000 new federal employees to manage.
Right.
Think about that.
Okay.
So what we have to do is focus. We've got good health care. About 30% of better cure rates on cancer. About 1 million people a year live in this country that die in either England or Canada because of our system. We don't want to throw that out.
Right.
And what we can do everything the president wants. We can allow people to keep their insurance. We can not raise taxes. We can bend the cost curve down. We cannot put anybody in between you and your doctor. But it's going to require compromise, and we're going to have to put common sense into it, not government sense.
Okay, so Senator, let's flash forward here to this evening. What do you want to hear from the president? I mean, I know you would love to hear an endorsement of the principles you're outlining here, but you know, short of that, what would you like to hear? Maybe if not changing the goal, maybe changing the grip. What would you like to hear?
Well, I'd like for him, I would like for him to say, getting this right is more important than meeting a political deadline, because it affects every person in this country. No matter who you are, this bill is the biggest bill that this country will have ever faced and dealt with as far as how it impacts. So I would want him to back off of the timeline and say, let's get it right. #2 is let's start over, and let's not have truly a partisan that it's our way or the highway, because there really hadn't been hardly any reaching. We'll see if the Senate Finance Committee comes with that, but let's start over. Let's really do malpractice reform in terms of incentivizing it for state, not mandate it, but give the state some incentive to do that, because that's 8% of our costs right now in the country. Let's fix Medicare. It's unsustainable right now. If we're going to really fix health care, let's fix it all. Well, let's do it in a way that the American people won't charge it to their grandkids. Okay, that's the other important point.
Yeah. Let's do this. Let's continue this conversation. We love having you on the program. You know, we think you're a reasonable voice in all of this, and we're trying to stay out of the echo chamber of all the noise, and we're trying to stay focused on how to get this done. So if you wouldn't mind, we've got an open invitation for you to come on the program.
I'd be happy to. I'd love to come back.
We like having you on the program. All right, Senator Coburn, thanks for your time. We appreciate it.